Well, now that we're into the sunshine season, it's time to think about our risk for skin cancer. And this really hit it home for me. If you have skin, you are at risk. Dr. Philip Kerr is here from UConn Health Center. Good to have a doctor in the house when you're having a choking attack. Good morning to you.
Good morning.
Okay, so of course we have to think about the sun and our risk. And, you know, I didn't think of it that way before. If you have skin, you're at risk. And a lot of people aren't doing much to prevent their risk.
That's right. Everybody's at risk for skin cancer. Of course, people with fairer skin, redheads, blondes with real light skin are at higher risk, but everybody's at risk. I see patients who have darker skin types who come in who have skin cancer, melanoma, and other forms of skin cancer, and then also certainly fairer skinned individuals are at increased risk.
Well, and of course we know that melanoma can be deadly. The encouraging thing is that our best events and the thing that gives us the best chance is early detection, and that's something we can all do, but we're not doing it necessarily.
Not necessarily. What we recommend for people, especially people who have gotten a lot of sun, is to once a month take a good look at their skin, looking for new spots, especially brown spots or black spots, or changes to pre-existing moles. Those are two warning signs.
And don't panic, because it doesn't necessarily mean something is completely awry. Sometimes there are harmless brown spots, right?
Absolutely. Most brown spots on the skin are benign, but those are the warning signs, a change to a pre-existing mole or a brand new spot that melanoma can show up as.
You know, we sort of go back to the alphabet a little bit. You often hear about the A, B, C, D's, and there's an E, isn't there, as well?
Yeah, so E is the evolution, and that's this change that I was referring to. The A is for asymmetry, so we like a mole to be nice and symmetric. You know, if you could show a mirror, it would be the same on either side. The B is a border. It should have a nice sharp border. C is color. It should have a nice even color throughout. D is the diameter. Basically, the smaller the mole, the better, and the larger it is, more concerning.
Is this something that you should be doing yourself, running through the A's to the E's, or is this something you should really go to the doctor on a regular basis just to have a set of professional eyes on it as well?
It certainly doesn't hurt to go in and see your primary care doctor or certainly a dermatologist as well. But what people can do at home is looking for change, and then when you have a concern, then that's when you show it to your primary care doctor or a dermatologist for them to give expert opinion.
Of course, we also need to apply our sunscreen. We hear that, but we may not necessarily be doing it correctly. How should you apply sunscreen?
So it's important to apply sunscreen prior to sun exposure. A lot of people, they show up at the beach or show up at the swimming pool and then start to put it on. Really, you should be putting it on 15 to 20 minutes ahead of time so that it has a chance to bind into your skin and activate. And so then the other thing is that once you've been in the water, then you need to reapply it.
Well, and I think, too, you should put it on ahead of time, because how many times, it's happened to all of us, you get there, then an hour later, I forgot to put my sunscreen on. So that just makes sure you definitely have it on. And then again, reapplying it. One coating first thing in the morning is not going to last you at 6 p.m., right? It needs to go on again. That's
correct. We say every 2 to 3 hours, sunscreen should be reapplied.
Okay, well, I can tell you've kept your skin very nice. Nice and, you know, it looks, you can't see it in person, but it really looks good. So thanks. You're practicing what you preach. Thanks so much, Doctor.
You're welcome.